Hello friends, I am Dr. Girish Bhalerao, Senior and Chief Orthopedic Surgeon and Consultant here at Mumbai. Today we are going to talk about knee joint and its problem related to. The most common often problem to the knee joint is osteoarthritis. Osteoarthritis is a problem which most of us are going to go or many of us are already suffering from. Osteoarthritis is an issue where the smooth surface of the cartilage which forms the end covering of the bones which goes into the formation of the joint starts getting degenerated and over time can show crackling and a lot of disability. Osteoarthritis is a problem where your cartilage gets damaged progressively, decreasing the range of motion, and sometimes even can affect the stability of the joints, not allowing you to carry your functional activities of daily living and can be very much debilitating to get you to even bed rest and wheelchair mobilizations. So many a times patients are using a walking aid support to even do their routine activities like moving in and around their house. So osteoarthritis is quite some severe issue. To solve this, we can treat the osteoarthritis at various stages. In the initial stages, certain medications and physiotherapy programs can be useful. As the disease progresses, certain intra-articular injections and regenerative medicine can also be employed. We specialize in regenerative medicine, offering you even stem cell therapies and growth factor concentrates to reverse the early stages of osteoarthritis. However, as the disease progresses, and many a times when patient comes to our OPD, they are usually in such kind of advanced stages like stage 3 and stage 4, where not only your pain, but it is also affecting your range of motion, your instabilities, and allowing you to walk with these kind of support systems. At that situations, we do offer something called joint replacement. A joint replacement is a surgery where the end surfaces of the bone are resurfaced with metal back implants, offering you a good range of motion so that the bone does not rub onto itself. As the disease progresses through various stages, the joint replacement can be offered based upon which compartment is affected. If it's a unicompartmental affection, we can offer you something called unicondylar or a partial knee replacement, versus when it's a tricompartmental affection where most of your joint arthritis is progressed, we can offer you something called total knee replacement. These replacements allow you to re-establish your biomechanical axis to your original pre-arthritic alignment, making this joint a more conducive to your natural feel. To offer this procedure, we do something called minimal invasive customized robotic joint replacements. Minimal invasive is a technique in which we do not cut open any muscles. Your entire soft tissue coverage is absolutely intact and there is no muscle loss or post-operative rehabilitation is much less. With this, the recovery is much faster to an extent that we allow the patient to walk on the same day within a couple of hours as soon as your anesthesia wears off. With customizations, we do your scans and feed it into our computer system, on which we do your surgery on a computer before we actually take you to the surgical theatre. This way we are much more specific about your anatomy and we can replicate your anatomical alignment with the help of this implant. A robotic technology allows us to improve the precision so that not even 0.1 mm deviation should be accepted and give you the most specific, the most customized and the most stable joint replacement, which will work you for longer years of life, requires much less rehabilitation and make you feel your joint as your own natural knee. With this kind of technology, your activities are much more better. Not only do you get back to your routine self, but can also challenge more like sports and athletics. Wish you all the best. Please do take care of your joints and in any help, do connect us and let us help you to get back to your feet. Thank you.